So my pleasure to be here. We're talking about advanced cranial osteopathy. This is a technique that I approached with five-level diagnosis and treatment. Problem that we often have is, what do you do when your cranial treatment is not getting results? I think we look to our diagnosis by covering the history, physical, medications that the patient is on. But more importantly, as an osteopath, we look at the bones, membranes, central nervous system, fluid, and energy, or chi. So we have three goals to diagnose and treat head and face pain associated with somatic dysfunction at this high level using cranial techniques. And second goal is to accurately diagnose these five levels: bone, membrane, central nervous system, fluid, and energetic attributes. And then we're going to develop an efficient and effective treatment plan in treating the principal level of the five-level somatic dysfunction you identify. The objectives are to diagnose and correctly treat these five levels of patients, and then to remove the bony and sutural restrictions of all 22 bones, and finally the membranous restrictions. And you're going to diagnose at least two out of the three of these difficult ones that are difficult to do. And that's the dense brain tissue, which is the central nervous system, fluid, and chi, or energy. So I will help you identify the ideal treatment based upon your patient's condition, location, the restriction, and deciding what kind of activating force you're going to use. So we're going to treat all bony, membranous, and fluid restrictions found in your partner's cranium with the proper activating force. And so we're going to then be concerned about the diagnosis of the primary respiratory mechanism of these five structures here. And you can just name them for him. So we're going to train our hands to be better instruments in sensitivity in identifying the five levels of dysfunction of the cranial sacral mechanism. So this all started in Kirksville at the corner of Jefferson Street and Osteopathy in Kirksville, Missouri. And this building on this side here, this red building, is the Old North Infirmary. And this building here that a student in 1898, graduating in 1899, William G. Sutherland, got the idea that the temporal bone was developed for motion. And here's a picture of Dr. Sutherland. And in 1997, 10 of his original students were alive. And here they are. Dr. Fulford, okay? And this is to Paul Kimberly. He was my chief. Edna Lay taught me cranial. Ann Wales is right here. Ken Little and Brooks Walker never taught, so they didn't teach me. But Tom Schooley taught me, and Alan Becker taught me, and Louis Hasbrook also taught me. We all have lineages that are our history. Yeah, so unfortunately, all these early DOs are deceased. But we all have a lineage, and just like any tennis player, tell me who your teacher was, and I'll tell you how good you are. One person that didn't make the photograph because she was preparing for her lecture again up in her room was Viola Fryman. And Viola Fryman and Edna Lay and Paul Kimberly were my principal teachers.